Hi, welcome to Integrity Orthopedics. I'm Dr. Muradov. I am a fellowship-trained, board-certified orthopedic surgeon who specializes in hip and knee replacement surgeries.
My name is Raquel Jackson. I am a patient of Dr. Muradov now for the last 2.5 years.
I had a knee replacement, which had started out as being swollen and red and progressed to being extremely swollen, and the pain was pretty severe.
It started with back pain and my leg, my hip, clicking and popping non-stop pretty much. And it got where I had a constant limp. Became very noticeable and very uncomfortable. And I also started to notice a higher level of fatigue every time I walked. It got really bad where I couldn't even go to the grocery store. We love to travel, and it got difficult to travel even and move through airports. It really started to affect my life in a way that I couldn't do normal everyday things.
It's very rewarding taking care of patients with chronic hip disease because essentially overnight I'm able to take away their disability and give them back their life.
My impression was such that I had worked with a doctor who was not listening to me when I kept saying, there's something wrong, there's something wrong. I felt that I had been listened to and taken extreme care in how I was being treated and how my knee was treated. So I felt very comfortable. It was probably the first time in 7 months that I felt relaxed.
I really liked the way he took the time. He didn't rush me in, he didn't rush me out. My recovery was quick. It surprised everyone, and I think it had a lot to do with the approach that Dr. Muradov took with my surgery. But before we even realized it, I felt like 2 weeks in, I did not need the walker any longer, although Dr. Muradov recommended that I hold on to it, and I did. But recovery, within 6 weeks, you couldn't even tell I had had a full hip replacement. It was incredible.
By being fellowship trained, I feel comfortable assessing any hip or knee condition, regardless of how many operations you've had on that knee. I'm confident that after accurate diagnosis and treatment, we can get your prosthetic joint feeling good again to return you back to full function with no pain.